Hey squad, welcome back to the channel. My name is Mike and today's video is the second of 3 in our look into heart failure. If you missed last week's video on systolic heart failure, click the eye above my head to check it out. Last week we learned that heart failure is a chronic progressive disease where the myocardium or heart muscle becomes weakened and cannot maintain effective tissue perfusion. That is typically referred to under the umbrella term congestive heart failure, and that there is no cure other than a full heart transplant. Next week, we will cover the more commonly heard left and right sided heart failure, but today we are shedding light on diastolic heart failure. Diastolic heart failure occurs when the heart loses the ability to fill properly. There technically is no issue in contractility like there is with systolic failure. The patient's ejection fraction, or how much blood leaves the heart, does not decrease. However, the ability for the heart to hold enough blood within itself does decrease. Another way of picturing this condition is to think about a heart as fibrous with an inability to stretch. It's essentially stiff with little to no compliance. The first thing to be affected by the decrease in elasticity is preload. Without the heart's ability to stretch, the needed 50 to 80 milliliters of blood per chamber does not make it there. Hence, preload, or the amount of blood that enters the heart, decreases. Conditions like myocardial infarction or other ischemic heart diseases create very non-compliant heart tissue. This infarcted or injured tissue loses the ability to stretch and can develop into a preload deficiency, leading to diastolic heart failure. Acute conditions like cardiac tamponade and pericarditis can create conditions within the pericardial sac which can inhibit the heart's ability to expand. Cardiac tamponade is a fluid buildup in the pericardial sac around the heart itself. Typically, it is caused by trauma. Pericarditis is an infection of the pericardial sac, which causes inflammation. This inflammation, if severe enough, can restrict the stretch of the heart muscle. Now let's finally unpack afterload. Afterload is defined as the amount of pressure the heart must overcome to eject blood from the ventricles into the arteries. Prolonged hypertension outside of the heart would greatly increase pressure within the aorta, forcing the heart to adapt to overcome this increase in aortic pressure. The heart does this by hitting the gym, so to speak. It creates more myocardial cells within the ventricles, making the myocardium bigger. This increase in myocardial tissue limits the size of the ventricle chambers, decreasing how much each ventricle can hold. The last condition I want you guys to remember is called aortic stenosis. This is a condition in which the aortic valve becomes rigid and stiff. For the left ventricle to open this valve, more force is needed behind each contraction. Ultimately, the heart muscle must gain mass to overcome this valve. As stated, both aortic stenosis and prolonged hypertension lead to the growth of the myocardium to be able to overcome the afterload. Just remember that in the short term, this cardiac muscle growth is okay. However, over a long period of time, the heart will become overworked and turn flabby, losing its contractility, ultimately resulting in a change from diastolic to systolic heart failure. Well guys, that's it for today. As always, stay safe out there and I will see you in the next video.